Hi there. Today we're going to talk about heart failure. We're going to explain what heart failure is and then also ways you can help manage heart failure symptoms to help improve your life.
Dietary guidelines for heart failure patients, covering sodium, fluids, fats and cholesterols, and dietary fiber. Now, sodium. The Heart Failure Society of America recommends less than 2,000 milligrams of sodium every day. That's about a teaspoon. And the average American eats twice that. The goal to keep in mind is about 140 milligrams of sodium per serving. So you want to read the label. Low sodium and very low sodium, if you say that, you're required to have 140 milligrams or less. Reduced sodium, light in sodium, that's a percentage of the original product. So take the salt shaker off of the table. You can get an herbal salt substitute, but beware of potassium chloride. It's a salty tasting ingredient in a lot of salt substitutes. Fluids. You want to do less than 2 liters of fluid every day. That's about a half a gallon. Ice cream counts as a fluid. Yogurt counts as a fluid. And obviously soda is a fluid that you should eliminate from your diet. Fats and cholesterols are necessary for cushioning your organs and building new cells. There are good fats and bad fats. Good fats come from fatty fish and healthy cooking oils. Fatty fish include trout, salmon, albacore tuna. Good cooking oils, olive oil, canola oil. Bad fats and cholesterol come from animal fats, red meat, dairy, egg yolks. Saturated fats like hard margarine, palm oil, read the label. Palm oil is in a lot of things like Nutella. Jeremy, how can we eat better? We can eat better by eating whole grains, brown rice, beans, lots of dietary fiber, plenty of fresh fruits and vegetables. The cabbage family, broccoli, asparagus, have lots of dietary fiber. And lean meats, chicken, turkey's fine. Lean red meat once a week. Fatty fish at least twice a week. And limit your processed foods. Limit your sodas. Get rid of the sodas.
Hi, I'm Connor. I'm a PA student as well. I'm going to talk today about exercise and why exercise is important for heart failure. Incorporating exercise can help reduce your heart failure symptoms, help increase your energy, and help you become more independent. Exercise should become part of your daily routine. It should involve 5 days of 20 to 30 minutes of exercise, working up to that point. The activities can include things in flexibility, cardiovascular, or also strengthening. Examples are Tai Chi, yoga, walking, jogging, lifting weights, resistant bands. Make it something that fits you well, and a good idea is to do it with other people as well. Your exercise routine should involve a warm-up, which should be 5 minutes, the conditioning, which should be the 20 to 30, and then the cool down. Each section of your exercise routine is crucial to making sure it's safe, enjoyable, and effective. Overall, before you start exercising, make sure you check with your doctor before doing so.
Hi, my name is Nick. I'm a PA student, and I'm here to explain to you about the healthcare team. First is your physician-led team, which includes your PA, your nurse practitioner, or your doctor. They're the ones who are going to provide you with a diagnosis of your condition, as well as an explanation and medication management. They will also lead the rest of your healthcare team. Another possible member of your team is a physical therapist. They are available to help with any rehabilitation you may need after a possible event. Another member of the team is an occupational therapist. They're there to help you rehab activities inside and outside the home. This is Chris to help better explain occupational therapy.
For heart failure patients, occupational therapy really is concerned with rehabilitation, adaptation, and prevention, and occupation being defined as anything that is meaningful for the client in everyday activities. So for heart failure patients, we're really concerned about assessing the impact that heart failure has on their everyday life, as we had mentioned before. So we will actually do functional assessments, and we'll work with our primary care providers, making sure that the heart failure doesn't impact their everyday life in a dramatic way. So we'll work with the primary care providers and actually do functional assessments to see the level and impact that heart failure has on our clients. After the assessments have been made, we'll actually come up with some occupational goals for the client, with the client, and they will include a range of edema control, endurance exercises, or even adaptation techniques to help them reach their occupational goals. Reassessment of functioning is always important to identify ways to increase new habits, rituals, and roles into the everyday life of occupation.
Another member of the team is a dietitian. They'll help you manage your diet with grocery lists, what to eat when you go out to eat, and any specific intolerances or conditions you may already have. Help tailor your diet towards that.
Okay, before we recap, important components to managing heart failure include diet, exercise, and working with the different members of the healthcare team. Feel free to pause the screen to review the text here.
Congestive heart failure occurs when the heart fails to pump an adequate amount of blood to meet the body's needs. Fluid accumulates in the heart, the vascular system, and the lungs. In the lungs, this causes pulmonary edema. With each beat of the heart, about 60 to 80 milliliters of blood is ejected to meet the body's needs. In congestive heart failure, the heart muscle begins to lose its ability to pump efficiently, and not enough blood is ejected with each beat. The lack of oxygenated blood will cause dyspnea, tachycardia, and tachypnea. This is the body's attempt to compensate for the decrease in blood flow. The heart cannot take in more blood. The fluid then begins to back up in the venous system, leading to neck vein distension and edema of the feet and lower legs. In congestive heart failure, only one side of the heart may be affected. In right-sided failure, there will be further congestion in the liver and the spleen, causing abdominal edema. In left-sided failure, fluid backs up into the lungs, causing pulmonary edema, a life-threatening emergency. In addition to severe dyspnea, there may also be blood-tinged sputum. Congestive failure leads to an enlarged heart, distended neck veins, liver and spleen congestion, abdominal edema, lower leg and ankle edema, and pulmonary edema. Treatment is aimed at reducing the fluid congestion by the use of diuretics, restriction of fluid, and salt intake. Cardiotonic drugs are also used to slow and strengthen the heart.